the H3N2, and then the H1N1 influenza viruses, they are nothing new to us. They've come and gone before. If you remember, several years ago, we mentioned things about bird flu, mentioned about swine flu, and they are here again. Usually, they are supposed to have originated or emanated from birds and then to humans, or swines and then to human, and then humans start spreading it among themselves. The symptoms they come with are just about the same as any flu-like symptoms we have. The difference from any other flu that we may have will be in the cause of the causative of this particular flu. There are other viruses that cause flus. The common cold we have that doesn't come with so much fever and so much of people feeling so ill like we are seeing in these past few weeks, is because they may be caused by other viruses whose virulence are not as terrible as this one, or as not as bad or as wicked as this one. So we've been getting flu from things like rhinoviruses. We have rhinoviruses that are common cold. They are there with us all the time. They don't give us much problem, but these are seasonal ones that come as an epidemic, a seasonal epidemic. They come to display and then cause a lot of havoc in terms of ill health. Usually death rate is not that high, but if you ask what the difference is in terms of the viruses that are causing the problem this time, and their peculiar way of acting and the kind of symptomatology that they exact on their victims or patients for that matter. And these symptoms, I'm sure you are aware now that we are seeing a lot of people come to the hospital. They tell you they are feeling very weak. They have a cold, they have sore throat, they have cough. And usually their temperatures are very, very high. You hear this kind of symptoms among so many people. Not many people come to the hospital with common cold that we used to know, and they have temperatures of 38, 34. And it's all over the place, from children to adults. And yesterday I saw so many of these things. So that is what I can say is the difference. It's just that the causative this time is by the H1N1 virus, flu virus, and then the H3N2 Haemophilus influenza viruses.
Now, schools have been identified as high-risk areas. How should authorities go about it in handling these children?
Yes, of course. There are places where they are crowding, whether we like it or not. Schools are places where kids go to crowd. And, kids, they'll be playing with each other. No matter how much you tell them to practice social distancing, it becomes very difficult for them because of the way they interact with each other. What schools can do, I was just telling somebody that if it was some other jurisdiction like in Europe or in America, they can quickly close schools down. And in those jurisdictions as well, because they have good stuff, let's say that they know that the flu season is about to come. So people actually go for flu shots. So temporary shot that they take for the flu, so that not many people come down with it. So it's more like a yearly ritual or seasonal ritual where people go for their flu shots when they are about to enter the flu season. But here we don't do that. But one, if the matter or if the cases keep going up and the spread is becoming so much, then a decision will have to be taken, whether maybe to suspend school for maybe a week, and let kids go home and everybody isolate and recover and come back. That can be an option that can be looked at. It's a public health thing, because people are getting very sick. And I know a family that from their husband to their wife to the kids were all admitted in hospital, and it's been almost 2 weeks. They haven't even had their full recovery yet. So one, if we don't take the necessary precautions, then people would fall sick. It will affect school attendance in any way. It will spread among the children and their teachers and come and spread to the parents in the house. It will bring economic loss to the family. People cannot go to work. So we might as well take a decision as to, okay, maybe let everybody go home for maybe a week and let the recovery take place. Isolate and let recover. Because once you isolate, the viruses, because they are viruses, they are self-limiting. Symptoms would abate and people will get better.